Hi, in this video we'll continue talking about the problem of urinary incontinence after prostate surgery. There are two main surgeries that can cause incontinence in men, both related to the prostate. The first one is called the TURP, which stands for transurethral resection of the prostate. This is a procedure that is usually done for benign reasons. If you imagine the water pipe as a tunnel that goes through a mountain, the mountain being the prostate, so any enlargement of the prostate that grows inwardly can cause obstruction to that tunnel. So the idea of the TURP is to widen that tunnel again by taking chips of the prostate where the obstruction lies and removing them away. During the process of performing this, some damage can happen to the sphincter muscle because it's just below the prostate, and that results in a leakage of urinary incontinence in about 5% of men afterwards. The second main reason for causing incontinence in men, also related to the prostate, is radical prostatectomy. This is a surgery that is usually done for cancerous reasons. The surgery aims to remove the whole prostate gland with the aim of curing patients, and because the procedure is much more invasive than the TURP, then the likelihood of damage to the sphincter muscle is higher, and the percentage of incontinent men afterwards is also high. So in this video we'll outline the number of radical prostatectomies that are performed each year in the UK and the USA, and based on the likely percentage of incontinent men afterwards, the crude number of incontinent men after radical prostatectomy each year in both countries.
So what is the incidence of prostate cancer? In the UK, prostate cancer is the most common cancer in men, with close to 41,000 new cases diagnosed in 2010, based on statistics published in cancerresearchuk.org website. In the USA, prostate cancer is also the most common cancer in men, other than skin cancer, with close to 240,000 new cases will be diagnosed in 2013. There is a worldwide increase in the incidence of prostate cancer, and this was thought to be due to the incidental detection of prostate cancer after prostate operation, or TURP, where the prostatic chips are sent to the lab and prostate cancer is found inside the chips, or because of the increased use of PSA testing. PSA stands for prostate-specific antigen. It's a chemical that is produced by the prostate, and it could be measured via doing a simple blood test. And although the levels can rise because of benign conditions, they could also indicate the presence of prostate cancer, and this can trigger further investigations like taking a tissue sample of the prostate, the so-called prostate biopsy, and if cancer is found, then patients might proceed to have a major operation to remove the whole prostate gland. So how many radical prostatectomies are done each year? In the UK, about 5,000 radical prostatectomies are done in England each year, and in the USA, around 90,000 radical prostatectomies are performed each year. So if we do the math, and based on a good quality data, we know that up to 31% of men become incontinent 12 months after surgery. This means that in England, up to 1,550 men can become incontinent each year, which means one man every 6 hours after prostate surgery, or specifically 12 months after prostate surgery. And in the USA, the number is as high as 27,900, which means that one man becomes incontinent every 19 minutes.
So we saw from the slides that the problem of urinary incontinence is quite a problem of a large scale, and the important question here is that do all patients with prostate cancer need to have prostate surgery? Now the answer to this question is quite difficult, because there's a lot of research at the moment into trying to find out what is considered as clinically significant prostate cancer and what is considered as clinically insignificant cancer. There's already a classification system which is known the vidIQ classification, where prostate cancer is defined into low risk, medium risk, and high risk based on the aggressiveness of the cells and the level of the PSA. And also the volume of the cancer is taken into consideration when considering treatment for prostate cancer. However, even using this system, a lot of patients who are considered low risk are offered prostate surgery, and this trades their low-risk cancer with a lifelong problems with urinary incontinence and erectile dysfunction. So the main research question now is, how can we define clinically significant prostate cancer accurately, and what kind of threshold we need to have to trigger treatment? Hopefully the future will bring more answers or more clear answers to this question, and less patients will have to undergo prostate surgery if they have a very insignificant prostate cancer that could just simply be watched by doing serial PSA blood test and serial imaging like an MRI, or repeat biopsy if need be. Thank you.